Hi folks, if you have elbow pain, you're going to want to watch this video. So we have a young gentleman here with some lateral epicondylitis. Lateral epicondylitis is the fancy word for inflammation of the lateral epicondyle, which is right here on the outside of the elbow, okay? It's also called tennis elbow. He doesn't play tennis though, do you?
No, not at all.
No, he's not a tennis player. But he got it from lifting weights, which is really common. So what we're gonna do is we're gonna start out with a little bit of Graston technique. So you can buy these tools online. These are rock blades, but they have all different types. They even have the $30, $40 cheap ones. They're all slightly different based on the edges here. And you see here, there's some China gel on here. I normally don't promote Chinese products. I'm American, in case you can't tell, and I normally promote American products, but I do like this China gel. If you want to find another topical pain reliever that's made in America, be my guest. It all works, okay? So we're going to just spread this here on the elbow. And so here, we're scraping along the tissue, and you feel that? You feel those like bumps right through there, right? So you can actually feel the muscle adhesions in the tissue, underneath the tissue here. So what I'm doing is breaking up adhesions in the interstitial tissue to help it glide over the muscles better. That's gonna help alleviate his pain. And tennis elbow is just an overuse injury, and he's been working out a lot and he's overusing it. So I told him to take a break. You know, somebody that's into bodybuilding taking a break, it's not easy. It's not the words they like to hear. Most people do not want to hear that, just like powerlifters hate it when I tell them stop powerlifting. If you're competing, that's another story, but if you're just doing it for fun or to gain muscle weight or something, there are other ways to gain muscle weight without powerlifting. And powerlifting is generally not safe, or not as safe as weightlifting with Nautilus machines, where it's a controlled motion, a controlled movement on the machine. So free weights might be, some free weights are middle or moderate risk, whereas powerlifting is going to be a higher risk because it's heavy weights and free weights. So there's a lot of room for not only error, but injury, okay? So I'm having him just take a break for a week or two while we get this under control. And we treat lateral epicondylitis uniquely in the sense that, yeah, we do some Graston technique, and you might find a lot of therapists do this, but we also do cold laser therapy. So we're gonna do Graston technique first, and then we're gonna do cold laser therapy. And you notice in the middle of the arm here, I'm going up towards his elbow, but when I get up at the elbow joint, I go down. So you always want to strip away from a joint if you're starting very close to the joint. You want to strip away. You don't want to go up into the joint necessarily. You're not going to hurt them, but you just don't want to do that repetitively for 30 strokes here. And we're going to do about 30 strokes here on his elbow. You feel that? The crunchies in there? Yeah. Those are the adhesions. And let me see if I can find an area that doesn't have them so you can see the difference here. See that? See the difference there?
Yeah.
And you're going to find them right there. Yeah, see that? So that's part of that tennis elbow here. So you'll see now I'm above the elbow joint, but now I'm at the joint right here, and I'm pushing away from the joint this way. See? So again, I'm at the elbow joint, and I'm pushing away. Now if I go up in the middle, I can come towards the joint, and you feel those adhesions in there, right? And that's getting a little bit into your tricep, and then your pronators are right here.
That right there.
Yeah, right in there.
That's
Yep.
okay, yeah.
Yep. And that's right where the pronator attaches.
It's like the first time I can actually find the pain.
Is it?
Yeah.
Yeah, so he always had a hard time describing where the pain was. When I first examined him earlier in the week, he had a hard time kind of locating the pain, and that muscle comes all the way down here. So you hurt right at the insertion of the muscle, or the origin of the muscle. Doing okay there? Mm-hmm. Okay. Now, just going to wipe some of that gel off. This gel has menthol, so it does create a bit of an analgesic effect. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like, and don't forget to subscribe. Appreciate you guys.